Hi, I'm Tamitha. I'm one of the nurses that you'll find on the postpartum unit after you leave labor and delivery. After you get into the room, we'll get you situated in bed, and either a patient care assistant or one of the nurses will take your vital signs, and we'll listen to your lungs and your heart, and then we'll check to make sure you're not having any unusual bleeding or any other problems. If you're vaginal delivery, we'll be getting you regular diet, any kind of juices, sodas that we have. If you're on clear liquids after having a cesarean section, you'll be given Jello, juices, light juices, and you'll also be given any kind of drinks. You won't have any food until your doctor orders it. With the vaginal deliveries, we'll have to assist you up at least 2 times to make sure you're okay and as needed. If you need more assistance after that, you can request it. For cesarean sections, we help you up after the first 12 hours, and then we'll help you up 2 or 3 times, and if you're okay, then you're able to go by yourself. The doctors will have to advance your diet and make sure that you're okay to take food, and they'll let you know when that can happen. We'll be getting you up, and when we get you up, we'll do what's called perineal care, and we'll be using these lovely disposable panties. You get 2 pair of them, and they wash out, and you just rinse them out in the bathroom and hang them up, and they dry really fast. And you get a few of these lovely big pads, but also we'll give you like small ones for the additional pads that you need. You rinse off your bottom with this warm water bottle, and this is all you have to use. It doesn't have anything in it. You just get warm water and spray your bottom off. You don't have to let the bottle touch your bottom, but just spray real good. You'll get a regular diet. You'll get celebration meals. Everybody gets a celebration meal, and you can have a guest, and it consists of pork, loin, a ribeye steak, or chicken. You get assorted sides and assorted salads and beverages. And also, if you have other children, you will be able to get a sibling party for them, which consists of a cupcake. They get milk, juice, a sticker saying big brother or big sister, and a certificate saying they're big brother or big sister. If you had a cesarean section, you will get a PCA pump for pain, and you can also have additional medications as needed. For vaginal deliveries, you will have medications that you can take by mouth, and there are also other medications that you can take as needed. We have medications for hemorrhoids, any kind of discomfort on your bottom that you need. We can get that for you also. When you get up and go to the bathroom, there's going to be an emergency call bell in the bathroom that if you need any assistance, if you're in there, if you start feeling weak or dizzy or anything, please pull it and call, and we come in here really fast to help you. After you have your baby, hopefully you will have a healthy baby, but that doesn't always happen. And we have a wonderful staff in the NICU, which is the Neonatal Intensive Care Unit. And when you're stable enough, if your baby had to go to high risk, we can take you there in a wheelchair and have you visit with your baby. A lot of times the mothers are breastfeeding, and what we can do is get a breast pump for you and bring it here into the room, or we also have a lactation consultant available if you need help with that also. You get to get little bottles, and after you pump your milk, you put the milk in the bottles, and then we have labels, printed labels that we put on the bottles, and they take it back, or your family or we can take it back, and they either put it in the refrigerator or the freezer for future use for your baby. Sometimes the babies get to drink, sometimes they don't get to eat anything, but you always have that supply that's always ready and available for them when they do get to do that. As far as breast care, you can, if you're bottle feeding, and everybody really needs to do this, is make sure they wear a good tight fitting bra. And if you're bottle feeding and when you go home, you're going to have to make sure that you keep the bra on, and you can use ice packs as your breasts start to feel. If you are breastfeeding, we make sure that you use warm compresses and continue to pump and use that. And you can also use Tylenol as needed for discomfort. If you want to room in with your baby, if your baby's in the well baby nursery, you're allowed to do so as long as you don't have any IVs or anything like that that would hinder you from caring for the baby. A lot of people with the C-sections don't opt to do that because it's a little more difficult for them to get up and move around. But you still have that choice if you want to try it, as long as you don't have all those pumps and IVs to carry with you. When you start getting up and you're able to walk, you may walk in the hallway with your baby, but make sure you keep the baby in the cradle, because the babies have to be safe, and just in case. We have those little hugs tags on the baby's ankles for security reasons. And if you notice in the hallways, you'll see some blue lights. Those are security lights in case the babies get anywhere close to those. Security can come up and make sure everything's okay and make sure nobody's trying to steal your baby. And when you get in the room, we'll also be giving you this intake and output sheet, which you'll keep up with everything that you drink on here. And we also have a little measurement scale here on the back of it. And you can tell whether you drink a cup of soda, a cup of water, and we measure it in cc's. And you'll write this down and we'll pick it up at every shift, at the end of every shift. Also, when you go to the restroom, when you have a cesarean section, you'll get your Foley catheter out the next morning. And after that, you'll be measuring this yourself in this nun's hat. And whatever side, on the CC side, on this right side, is what you measure. And you'll just write it down on your piece of paper here under urine. And then you'll just dump it out. And we'll show you how to do all of that as you get up to the restroom. And you need assistance going to the restroom, like I mentioned before, for at least 2 times to make sure that you're okay. If you have any other questions, feel free to call the hospital at 759-7111 and ask for the Women's Center. Thank you.